through on what would help out businesses, with council saying they want to help business bounce back in Brisbane. Helga at Goodna says free or perhaps $5 a day parking in the city would make people go to the city heart. Thank you, Helga. Well, they paused all the parking meters for 6 or 8 weeks, whatever it was. That cost the council, or they missed out on it, something like $2.2 million in parking fees. That adds up, doesn't it? Someone else says town planners are suffering with COVID losses as development has stopped. Sadly, some regulations are actually necessary to protect the amenity of neighbours. Thinking about whether your development will be a good neighbour, you know, whether you'd like to wake up and live next to it. Yeah, I take your point on that. It's not all, town planners are not just in it for the money, it's for making good neighbourhoods too. And someone else says it'd be great to have combined business, commercial with a small residential component. Addresses the cost of living, you work where you live. So that results in a caretaker on site too, just a small apartment area for 1 or 2 living areas, perhaps with a shared kitchen. And what about student or low-cost living areas at businesses? Well, it's going to be really interesting to see whether the student accommodation in Brisbane fills up again too, because of course in suburbs like South Brisbane and West End, which are full of high-rises, in a normal university semester they would be full of uni students. But they're not here at the moment, so you wonder what's going to happen with some of that accommodation too.
In an emergency, turn to a source you can trust. At the ABC, we're dedicated to helping you during natural disasters and extreme weather events, and to making sure the ABC is part of your safety checklist. Follow your local ABC on social media. Find and save your local ABC radio station. And for more ways to be prepared, visit abc.net.au/emergency. ABC Radio, your emergency broadcaster.
This is ABC Radio Brisbane with Rebecca Livingston.
20 minutes to 10. When can a positive test for coronavirus be negative? And are all COVID-19 tests the same? These are just a few questions that have popped up this week after Queensland Health confirmed a man who was thought to be Australia's youngest COVID-19 patient was not infected with coronavirus when he died. Perhaps you have a few questions too, as we continue to see the easing of restrictions. What do you still want to know about COVID-19? 1300 222 612 is the number to call, or you can send a question by text to 0467 922 612. This is the man who'll be answering your questions. Our regular expert, the Director of Infectious Diseases at the Mater Hospital, Dr. Paul Griffin. Welcome back.
Thank you. Good to be back.
Melbourne last week. This time last week, you and a team from the American group Novavax
That's it.
were injecting humans with a vaccine trial. I think you did 6 on the morning that I spoke to you. How many people now have the vaccine in their system?
So we did the first group in Melbourne last week, and that was really exciting. This is the first vaccine given to human volunteers in the Southern Hemisphere, so a big step forward. And then I came back to Brisbane and we've started dosing the rest of that group up here. So we've dosed around 50 or so healthy volunteers in Brisbane this week, and it's all going really well, so it's really exciting.
Going well, but what do you know? Like, is it too soon to have any sort of data as such?
It is. We carefully observe the volunteers continuously for safety and other things, and we'll put together some data on those in the coming weeks that will inform whether we proceed to the next phase, the phase 2 trials. But that's a few weeks away.
What are the first things that you look for, though, or that you're analysing?
So we want to make sure there's no local or systemic reactions, basically. So it's not uncommon, obviously, with vaccines to get a bit of a redness on your arm or a bit of swelling, those sort of things. So we very carefully monitor all of those things and record it really accurately so it's reported really well. So we monitor the volunteers for all those sort of things and any other problems that might pop up to see whether it's possibly related or not. And we'll follow them through very carefully till the end of the study for all of those things. And
it's a needle in the arm, like the flu shot. Did any of the volunteers come up red or with a rash or with that sort of soreness that you get after a flu shot?
I can't speak too specifically on all the results, but basically we've not seen anything that's any cause for concern at all. So nothing to report at this stage. We'll report on that really specifically in great detail when we've got that data put together. But yeah, there's been no problem so far.
We'll go with that highly scientific early conclusion at this stage. So far, so good.
Absolutely.
Associate Professor Dr. Paul Griffin in studio this morning and on Facebook Live as well. You can put your questions up on Facebook Live and he'll answer them too. Or you can send a question by text 0467 922 612. I've got a bunch of questions for you too, but I just want to go to someone who's obviously thought very hard about their question. This is Greg in Chapel Hill. Slightly complicated from my perspective, but maybe you'll understand it. Greg says the current SARS-CoV-2 vaccines attempt to elicit an immune response by mimicking the spike proteins from its viral envelope. Is that right?
Correct.
Greg says, I've heard that there are DNA vaccines too, but since coronaviruses are RNA-based, could there be a CRISPR equivalent? First of all, what's an RNA and what's CRISPR?
Good question. And I probably won't go too much into the science because it's a very complicated, very good question. So far, the only vaccine that's been produced on that sort of a platform was the Moderna one, which is what we call an mRNA vaccine. And what that is, so with the ones that I'm involved with, we're making that spike protein, but you can basically also use the code for that protein and actually give that as a vaccine. So that's what Moderna have done so that then we make that protein. And so the mRNA one does that. It is possible to do those other things that were in the rest of that question. It's not something that's being done essentially for the front-running vaccines at this stage, but the Moderna one is based on mRNA, and so that vaccine was the first one trialled in humans, probably around 2 months ago even now, and so that their trial is progressing as well.
Okay, that was in the States,
Correct,
wasn't it?
that was, yeah.
Yes,
America.
okay, and at the moment, no big news out of that. It's just progressing on track.
They've released some safety data, which was quite favourable, fairly small numbers though, and it's a really interesting platform, but I think we have to keep in mind that we don't have any licensed vaccines based on that sort of a technique just yet, whereas the protein or subunit vaccine, like the couple that I'm involved in, we've got quite a few vaccines already in use based on that sort of technology already.
What has been lost in amongst the unrest and the trauma of America at the moment is perhaps the regular or the focus of the Daily Count on COVID-19 cases in the States. It's now tipped over 105,000. Even though their scientists are working with you here in Australia on a vaccine, are you worried about COVID-19 in America, given that there are thousands of people in the streets at the moment?
I'm very worried about America, and I was before all these other progressions happened this week. I think that, obviously there's some big issues at play which are devastating in themselves and will be a challenge to resolve. But I also think the impact on COVID-19 of all of this will be very significant as well. Obviously social distancing and things like that are becoming a second priority based on the other things that are happening there right now. And I also think some of the focus being lost on COVID-19 will be a big step backward for a country that's already having a lot of problems with that. So I'm very concerned about what will happen in the coming weeks and months with COVID in America.
Meanwhile, in the UK, they have finally introduced a quarantine period for people coming into the country, but at the same time, they're opening things up. Is your sense that Britain's approach is going to keep things under control?
It's really hard to know because we've seen it's not just about the restrictions, it's also about how people operate within those restrictions. And, I think Australia is a really good example where we had the right restrictions at the right time, but then on an individual level, everybody did the right thing, or almost everybody, and that's why we've been so successful. Other countries had similar recommendations without the same success as us because I don't think they had it as widely adopted and as well adopted as we had. So it's really hard to predict what's going to happen in different countries from here. I think complacency is our biggest challenge moving forward now. A lot of people have the perception that this was something that's done and now it's about rebuilding, but it's about rebuilding but still having COVID around and doing it in a safe way.
Why has Japan done so well through all of this?
Lots of different theories there. Again, I think there's a lot of population factors that they listen to what they're told to do, as we've done. They had a very aggressive kind of approach of stamping down really quickly on any little outbreaks, which I guess is kind of what we're doing a little bit now rather than more broad-based approaches. So, and a population that adopted all those things really well.
Testing and then tracing seems to be key to success as well. How often is a COVID-19 test wrong?
So the big thing about any tests, we don't have any tests for anything in medicine that's 100% right all the time and doesn't occasionally miss things as well. So all of that, and we measure those things and we validate our tests so we know roughly what that is. And the test for COVID is really good, but it's not right 100% of the time. And so if you tested 100 negative people, it's very likely you'll get maybe one that is what we call a false positive because, as I say, none of our tests are 100% right all the time. And as we're testing lots of people that actually don't have it, which is what we want to do because we don't want to miss anybody, there will be false positives. And what that's really about, I guess, then is making sure we've got a really good, consistent, transparent way of following up those false positives so we know if they're real or not. And we've got other ways of doing the tests, confirmatory tests. We've got different types of tests, so we can do all of those to work out if the first test was right or not. I think we need to be really clear on that, though, and know that that process exists and has to exist, and that sometimes we'll get false positives. But all in all, it's a really good test, and we don't want this to detract from people going out and getting tested, because that's the big way where we'll stay on top of things.
So a false positive is rare. How common is a false negative?
Probably even more rare than a false positive. So with all these tests, we kind of design how, and we call it sensitive and specific, we kind of design that. So with this test, we really don't want to miss anybody. So we've made it really sensitive, and the consequence of that in some ways is that we'll possibly slightly overcall it at times. So we're more likely to get false positives than false negatives, provided the swab's done right on the right people. And so that's why we will see false positives from time to time.
How many types of COVID-19 tests are there in Australia?
So the main way we diagnose it, the best way of diagnosing is still that nose swab for what we call a PCR-based test. So that's where we're actually amplifying the genetic material of the virus. And that's why that test is so sensitive. It only needs a really tiny amount of virus to then amplify that up and give us a positive test. There are all sorts of other ways we can test for it, including blood tests. But blood tests really have very little role in the early phase of controlling it. The blood tests are good to do a look back to see how many people might have had it weeks or months ago. But the blood tests themselves, and a lot of people are asking for these because there's a lot of people advertising them on social media and things like that. But the blood tests have very little role in diagnosing someone in the early stages.
And that nasal swab, is it literally the same nasal swab as you get when you're being tested for whooping cough or influenza?
Yep, that's right. So all of those sort of viral and the whooping cough sort of bugs we do with those nose swabs, that they do go back a long way, so it is uncomfortable for a second, but it's really not that bad.
Okay, but the difference is what you're testing for once it goes back to a lab.
That's right.
Okay. Associate Professor Dr. Paul Griffin, the Director of Infectious Diseases at the Mater Hospital. To your questions on Facebook this morning, Taylor says, can you get COVID-19 twice? Do we know an answer to that yet?
We don't know for sure. We think it's possible, not very likely though. So how protective our immunity is, what sort of immunity is protective, who gets that and how long it lasts are still questions that are being looked at. So we certainly don't want anyone who's been diagnosed to assume they're protected and go and not do all the other things we need people to do. So having a diagnosis does not mean you're protected forever.
Deborah says, do children attending Sunday school classes need to follow social distancing guidelines?
The short answer with this is it's really hard to know exactly where to apply that and which situations it's not applicable. And so in short, if there's any way you can maintain social distancing in any situation, I would recommend it moving forward. So if there's a way of doing that safely in that environment, then I would still try and do it.
Wingsing, this is on Facebook Live. So Wingsing, hello. How effective will the phase 2 vaccine trial be if there are minimal active cases of COVID-19 in Australia?
So that's a good point. So we won't be able to do the entire phase 2 in Australia because you need some transmission in the community to be able to show that the vaccine's protecting people. So the phase 2 will be in at least 2 countries. Where that is will depend a little bit on the situation at the time, where still has enough cases for us to be able to test it there, and I guess where it is also safe to be able to do the trial. So it's likely to be Australia and the US, but that situation may change.
Tessa would like to know, I would like some advice on singing in choirs. And in your opinion, Paul, is there a higher risk for contracting COVID-19 than just being in the same room as other people?
It has been talked about that is a way of actually expressing the virus more. I guess if we think again about the fundamental ways we're going to stop this, if you're unwell with anything, don't go to choir or choir practice. If you've got a runny nose, sore throat or any possible symptoms, then you should go and see a GP or get tested and stay home till you have that result. So that's going to be our greatest way of making sure choir practice or those situations are safe. And then if you can spread out, if it's practical to do that, then I'd advise that, because it is possible that it could be spread that way. But if everyone who's sick stays home and we keep testing, we know where our cases are, then all of those things become relatively safe.
Might depend on the song you're singing, Tessa. You know, if you're a hard rock choir and sort of belting out Jimmy Barnes, there's probably a bit more spittle flying around the room. Josh would like to know, how much does a COVID-19 test cost?
So it depends a little bit on exactly which way it's being done and who's doing it. So it's basically free for everybody though. So if you want to get tested, there should be no charge. Obviously it depends on your GP in certain situations, and I can't speak to all of those, but there are certainly still what we call fever clinics or testing clinics available at most major hospitals where you can just walk up, get swabbed and go home and wait for the result. Key thing there though is if you do get tested, you do need to stay in fairly strict quarantine until you get that result, because what we don't want is someone that gets tested and then goes to the shops on the way home and does a whole lot of things, and then if they get tested positive, we have to go back and track all the people they might have been in contact with.
And it's a pretty quick turnaround, isn't it, for the result?
It is. So typically less than 24 hours, and most places are actually doing it a fair bit quicker than that even, but we say 24 to 48 hours just to be sure.
Yes, okay, so hopefully free to get it done. But what about the actual cost of the swab, or is it hard to put a figure on that because then you got to factor in the doctor's time and the trip back to the lab?
Depends a bit on which way it's being done. So when I say we do it through this PCR kind of test, there are a few different PCR kind of tests. They all perform very well, and the price varies from, I think the cheapest one's probably in the vicinity of $40 upwards to maybe $100 or so. But the main thing is we want people, and that's not cost to people. I want to be really clear on that, so people don't get charged that.
Yeah.
But we really want people to have a really low threshold for getting tested, so we don't miss any possible cases.
But $40 would be the cost of per test, because we've done almost 200,000 tests in
That's
Queensland.
Right. So it's not an insignificant number, and I think it needs to be kept in mind that a big part of our success here is that we've had such rapid, ready access to really good quality tests. And while we kind of maybe a bit complacent about that, there are lots of countries where you simply can't get these sort of tests done. So they may not even know how many cases they have or what's happening. So we're in a really good position here, and it's taken a lot of hard work to get there, and it's it's making a huge difference.
Talitha would like to know, when can universities go back to face-to-face study?
It's one of those things that depends a little bit on the pros and cons there. So it depends on, I guess, how critical face-to-face contact is for delivery of your course and what sort of face-to-face contact for how long and all sorts of situations. I know that with the University of Queensland Medical School that I'm involved with, that students are coming back in the coming weeks. But I think it's still important, and this is a broad comment, but if you can do something, study, work, have a meeting, if you can still do that activity through a non-contact, a distance sort of way, so via Zoom or whatever, it would still be preferable to keep doing as much of that sort of stuff as practical remotely, just until this really dies down, which might be months away yet.
Craig has sent a text saying, I'm wondering exactly what are the protocols around the isolation of people confirmed with COVID-19. He says, I always thought or assumed that they were taken to hospital as soon as they were diagnosed and isolated there until they tested negative. But lately I hear numbers like 20 active cases in Queensland, only 6 in hospital. Where are all the others?
So this has evolved over time. Certainly initially they were all admitted to hospital and admitted there for some time, so we could keep a very close eye on them. We've transitioned to a slightly different approach. So if people are really well, which is obviously the majority of people, so most people have a fairly mild infection, if any symptoms, to be honest. So those people can be managed at home, but we do that in a supported way where someone from hospital or public health will stay in touch with them. And in most cases it's every day, so they can be isolated at home but with close observation by the appropriate authorities. And then in terms of when they can come out of that, it actually depends a little bit on a few different circumstances, but in most people it's a matter of time, and it usually works out to be about 14 days.
Right, and the numbers that I have, which I expect to be updated just after 10 this morning when the Premier gives a press conference from Airlie Beach today. Queensland at the moment, 5 active cases, 1,047 people have recovered. There have been 6 deaths, and the total confirmed cases, 1,059. Daniel says, how does being on 40 milligrams of prednisolone increase my risk or severity of COVID?
So all immune suppression probably has some kind of role, but with prednisone or steroid-based immune suppression, it's not been one of the big factors that's come out of a lot of the studies so far. It's mostly other comorbidities. Age is still particularly one, and then other things like heart problems and lung problems more so. But I'd encourage people, if there's any specific questions about their individual risk, they should see whoever prescribes that for them to get assessed and see if that's still the right thing.
Paul, Sue wants to know, can COVID have gastro symptoms?
Absolutely. So abdominal pain, diarrhea are certainly potential symptoms of COVID, and we have found that it is shed in the stool, and that's why some very clever people at UQ have set up some sewage testing to keep track of where it might be. So it's not the predominant symptom, so it is still respiratory mostly, but yeah, it can have tummy symptoms.
Eileen says, do you need to wipe over groceries with antibacterial wipes or Dettol after bringing them home?
I would say no to those sort of things. Again, if sick people don't go to the shops, if we do our hands when we get there and when we get home, if we only touch the things that we want to buy, so if we limit the contact there to fairly essential things, then the risk of there being any virus on those sort of products is exceedingly low. We never like to say zero, but it would be exceedingly low. And I would say below the threshold for which that it would potentially be enough to infect you. So I think those sort of things, unless you're worried about a specific contamination event somehow, which would be really unlikely, I don't think that sort of thing is necessary every day.
Paul Griffin, I have to hold back from giving you a hug each week from coming in because that's what I'd like to do, but I know I'm banned. Well, I think I am. I don't know. Where are we at on hugs? Can you hug your friends? Can grandparents hug grandchildren?
Again, I think we should limit those sort of contacts still for a while yet. So certainly within the household, it's okay, particularly with your kids and anyone who you live with. I think we should still limit contact with other people. I know grandparents is a really tough one, but certainly handshakes and hugging as a greeting I think would be something we shouldn't consider for a while yet. I think lots of people have creative ways of alternate greetings in terms of waving and all sorts of things, so I think that's a better approach for now.
Blanket or sheet over the top of the child, in you go for the hug. Jane from Graceville says, I love my weekly dose of Professor Paul. I tune in every week to hear his reasoned answers. I've appreciated his time over these long weeks. So good that we have his big brain working for us in Brisbane.
Great. Thank you very much. That's very nice.
I think many people echo those sentiments. Thank you. Come back next week, though, won't you? Because we won't have it all solved by then, I don't think.
I don't think so.
If you've got the time, we'd love to see you. Associate Professor Paul Griffin. After the news, I'll take you to the movies.